I'm Dr. Hilary Coulombe from Glen Oak Dog and Cat Hospital, and today we're going to talk about parasites in cats. My assistant Evelyn here is going to ask me some questions.
Hi, Dr. Coulombe. What are intestinal parasites?
So intestinal parasites, kind of like they sound, so they live in the intestines, and they're typically worms that will live in there and can affect your cat's health, which we'll talk about in a second.
How does intestinal parasites impact the health and well-being of your cat?
So the parasites can steal nutrients from your cat. They can also attach onto the lining of the intestines and can cause anemia, which is low red blood cells. So all things that are pretty critical to your cat.
All right, what preventative measures can be taken to ensure that my cat doesn't get worms or other parasites?
So the biggest thing is making sure that you keep your cat inside. If your cat does go outside, then just making sure that they're on prevention. And so that would be making sure they have flea and tick prevention as well as a monthly dewormer medication.
All right, what are some parasites and what are the signs and symptoms of some of them in cats?
So the main parasites that we see, roundworms, tapeworms, hookworms, and whipworms. The biggest thing that you'll usually see, sometimes you can see these come out in the stool. Tapeworms are like little rice segments, and roundworms usually look like long spaghetti, although you don't always see them. Sometimes it's just microscopic and it's just the eggs that are coming out. But if your cat has any sort of loose stool, mucus in the stool, foul odor, those would be all signs we'd want to get that checked out.
Okay, what about ringworm?
So ringworm, common misconception and silly name, it's not actually a worm, it's a fungus. So we can talk about that later.
Okay, can you see, well, you just said you can see worms in your cat's stool, what is a different way to diagnose intestinal parasites in your cat?
So you're not always going to see them like we just talked about. So the best thing you can do is to bring in a fecal with you, ideally less than 12 hours old. I know sometimes it's tough to catch, cats especially using the litter box. And if you have a group of cats, if you have a couple at home, 2 or 3, one stool sample will be sufficient for all of them. If one cat has parasites, if they're sharing a toilet, it's likely that they all do. So bring in that stool sample. What we do is look under the microscope for those parasite eggs. So those are the things that we can't see. If we see parasite eggs, we know there's likely parasites further upstream, so we want to get you a dewormer medication.
Are there different treatments for different parasites?
Yes, so unfortunately there is not one size fits all, so really dependent on what type of parasite your cat has, so that's why we want to see that stool sample, or if you can take pictures of the worms that you are seeing so we can get the appropriate treatment.
Okay, why is early detection and diagnosis so important?
Like we talked about before, these parasites can steal nutrients from your pets. I've seen cats become anemic or have that low red blood cell just from parasites. Cats can even form obstructions, so almost like they ate a foreign material. The worms can kind of ball up in their intestine and form an obstruction, which is a surgical emergency. So things can get pretty bad pretty quickly, so I really want to get that detected.
All right, when should I get my cat to the vet for deworming?
So we recommend once a year. Bring in that stool sample. If they're an indoor cat, they may not need to be dewormed every year. If they're an outside cat, like we talked about, you're going to want to do that monthly. And then obviously if they're having any loose stool, we certainly want to check a stool sample then. If you have any other questions, please feel free to give us a call.